Ellen, thanks so much for joining us on the Mommy Resume for our second season of Parenting Profiles. In this season, we're exploring the journey to motherhood and embracing the challenges and uniqueness of each mother's journey. Today, we're super excited to hear your story, especially as it relates to embracing motherhood again after loss and managing the challenges of the postpartum experience. Welcome.
Thank you. Thank you so much for having me.
Absolutely. So Ellen, tell us a little bit about yourself.
First, I am a Ghanaian woman and a mom, and to two amazing little boys who I love to distraction, but who also drive me bananas, and a wife, and I'm a physician and I'm an entrepreneur. I am 43 years old. Well, we'll be 43 in less than a month. Oh, thank you. In less than a month, I'll be 43 years old. And I started my family a little later in life because I was on my career path, working in, trying to get my medical degree and residency and things like that. And so I was a little late in starting my family. And we just relocated to Atlanta. So that's what's going on in our lives right now.
So tell us, Ellen, about your journey to motherhood.
So I always knew I wanted to have children. In my young, immature mind, I thought 3 would be a perfect number.
Okay.
I have a younger sister, and I knew I did not want to have an only child. I knew I wanted to have at least 2, hopefully 3. That was my plan, but you make plans and, God laughs.
Yes.
And so, I thought I would be married and have these babies popped out before the age of 30. Yeah, I didn't have my first kid until I was 34, I believe.
I see.
So as far as getting pregnant and everything like that with Evan, it was a very smooth process. We were like, okay, we'll try, and within 6 weeks I was pregnant. I was like, oh, well, that happened quickly. It happened faster than we expected. And so pregnancy was fine. I have fibroids, and it's something I've dealt with. Didn't really cause issues other than the fact that, it's something that just needed to follow, with my first pregnancy. And so, because of the fibroids, a few years before I got pregnant with Evan, I'd actually had a myomectomy. And because of that, I was not allowed to go into labor, and because I had a risk of uterine rupture. And so I had to have a scheduled C-section, and they wanted to deliver him at like 35 weeks, 35 or 36 weeks. And I thought it was a little bit early. And so I had to advocate for myself and for my child and say, that's too early, like his lungs are barely mature at this point. And so I was able to get a referral to see a maternal fetal medicine specialist who was like, it's fine to wait until 37 weeks. And so that's when I had him. I had him at 37 weeks, and he was born healthy and, happy and developing well. And then I was like, you know what? I don't feel my family's complete. I think we need another baby. And my husband's like, I don't know about that. So it took a little convincing, because he was just like, why mess with perfection? Those were literally his words. Why mess with perfection?
Oh man, yeah.
And so I was just like, I just didn't feel it. Just in my spirit, I just didn't feel like we were complete, And he'd been asking for a sibling and all of that too. And so we decided to try, and I don't think it took us too long to get pregnant the second time around. It didn't take us very long to get pregnant. And then, I was excited and things were going well. I had my initial pregnancy visit with the OBGYN, and they were like, we should schedule an ultrasound for you at around, 6 weeks or so.
Yeah.
And so at 6 weeks, I went for an ultrasound. They were like, you don't really see the heartbeat, hear a heartbeat, but it could be a little early. Your dates could be a little off. So come back in a couple of weeks.
Okay. Wow, a couple of weeks.
Yeah. And so the particular OB I was with at the time was managing all of this, something just did not sit right with me. And so I don't know OBGYN. I'm an eye doctor. I haven't done anything down there in that part of the body for a very long time. And so but my best friend is an OBGYN, and she was just like, that's a little long to wait, but she's like, I'm not your doctor, so I can't, change your script or anything like that. But but at the same time, so you're pregnant and and your body's changing, during
Yeah.
pregnancy already. I
Yeah.
was already starting to show, because
Mhm.
you put on some weight after the baby and it doesn't quite go away, and so
It
things
doesn't. It
change.
doesn't. I'm still fighting it.
So, I felt like I was already starting to show a little bit, you get the fullness in your breasts and all of that
Mhm.
stuff already starts happening. And so I went and got another ultrasound at 9 weeks, and there was no heartbeat.
Mm.
And so at that point, I'd already started looking for a new OBGYN, and I actually had an appointment with her the day after my ultrasound.
Mhm.
Um, and so I saw my new OB, who was amazing. And she was like, I'm sorry, these are what the results show. And so she told me that my options were to have a DNC,
Mhm.
or to have a chemical, let the miscarriage pass on its own, or take medication to help it pass.
Wow.
And I decided to opt for the DNC,
Mhm.
because I wanted answers. Just because, I wanted to know whether it was a genetic thing. I wanted to know
Mhm.
what had happened, what had gone
Mhm.
wrong.
Mhm.
And so I had the DNC a couple of days later, and they sent the fetal tissue for genetic analysis, and it came back abnormal. Without getting into the details of it, came
Yeah.
back abnormal. So then it was like, okay, do Linwood and I carry some sort of genetic abnormality in our chromosomes that caused this to happen?
Mhm.
Because again, I wanted answers,
Of
because I
course.
was like, I had a healthy pregnancy. How did this happen? And it
Yeah.
was a little girl that we lost
Yeah. I'm
too.
sorry.
And
Mhm.
so he and I went for genetic counseling, had testing, and everything came back normal on our end. So
Mhm.
it was just something that happens, right?
Mhm. Mhm.
So after the miscarriage, I told a couple of friends, and I was just shocked at how many people were like, oh, yeah, that happened to me too. Or, oh, yeah.
Yeah.
So many women have miscarriages, and it's not something we talk about.
Yeah.
And
Mhm.
so I had some comfort knowing that I wasn't alone in this, but at the same time, it was, there's a lot of self blame,
Yes.
as a woman. And I felt like my body failed me and betrayed
Mhm.
me.
Mhm. Mhm.
And so I did not realize at the time that I was internalizing all of these emotions. What I started to do was exercise. That became
Yeah.
my therapy. I really,
Right.
I just was, wanting to just sort of work out my anger and frustration through exercise. And so I joined like Orange Theory Fitness, and I was doing
Mhm.
that, like 5, 6 days a week, and basically
Wow.
wearing myself into the ground, because it was just, I was just like, okay, I have to do something. Like, I need to change something. I must have done something wrong for this to happen.
Mhm.
And I came to the realization that it wasn't anything I did eventually, but at the same time, I was like, okay, I still want to have another child. I still want to try to have another
Mhm.
child, but I want to be in the most healthy, and be in the healthiest place possible, and do everything to make sure that everything that's in my body is in the best environment for my unborn child. And
Right.
that's when I delved into personal care products and started
Mhm.
finding out about all of the toxins and endocrine disruptors that are in a lot of the personal care products that we use. And that's how I found Beauty Counter and got involved with using the products, and eventually started my own business.
Mhm.
Um, so that's how I, dealt with that aspect of things. The
Mhm.
other thing, though, was that the second time around to get, I guess the third pregnancy, just it took longer
Mm.
to get pregnant.
Mhm.
This last with Caleb,
Mhm.
and I couldn't figure out why. It took almost 8 months after
Okay.
miscarriage to
Okay.
get pregnant
Mhm.
again. And my doctor was like, if we get to a year of I'm not able to get pregnant, then we'll look at your fertility options
Yeah.
and do additional testing. But then we got pregnant, and I went for that 6-week ultrasound, and there was a heartbeat. And the way I cried
Oh.
when that heartbeat was there, just because I was just so anxious,
Yeah.
after having been through everything before. Um, and
Yeah.
so
Mhm.
it was very emotional,
Yeah.
experience. So the pregnancy went okay. It was fine. It was just a little harder. I was a little older, I was having some aches and pains that weren't there before.
I understand.
I developed symphysis pubis where I could barely walk because it was like some laxity in my pelvic joints. And so I was in physical therapy, and it was pelvic physical therapy was helpful. But it was definitely harder. And I felt like God was telling me, this is it. You're good. 2 is good.
2 is good. No need to push it.
Exactly. So I have 2 little boys, Evan and Caleb, who are 9 and 4 and are a handful, but they are the light of my life. So that's amazing. So that's basically my journey to
So often I've heard that doctors are the worst patients, right? So would you say that your background, your training as a physician helped you manage this journey a little better than you would have if you didn't have medical knowledge? Or it was just literally, just visceral or emotional? What would you say?
No, I would say that my knowledge definitely helped. And then the fact that I had resources and I have friends I could call to be like, hey, this is what's going on. Is this normal? Is this not? Definitely tapping into the resources that I had. Just like they call me for eye stuff, I call them for other things,
Healthy exchange.
Exactly. Curbside consult from a friend. So having, and then my OBGYN, who also I will say was amazing. She became a friend. And so she was just like, this is my cell phone number. If you need anything, if there are any issues. And I definitely did not abuse that. So I would just call my best friend. But no, I think having that knowledge helped me, advocate for myself and for my unborn child. But, as we know, Black maternal mortality numbers are horrible in this country. And so, I unfortunately, I have to consider we have to consider ourselves one of the lucky ones, right?
Yes.
Who had good outcome. And so, it was the delivery experience, the C-section, everything went well. Second time around. The first time I had some complications post C-section, but nothing life-threatening. Is just like wound-related issues. But yeah.
And how did you feel like the second, I guess your third pregnancy, getting pregnant again after a loss? I understand that you're probably anxious. Was it a particular kind of anxiety, or like how would you explain what you went through emotionally?
I don't think I was able to breathe and relax until he was born, until he was there and he was alive and he was breathing. And even after his delivery, I actually went into postpartum depression.
Yes, we're going to
from the anxiety related to that. I was just like, I think because of my knowledge, I also recognized that I had postpartum depression. And I would cry uncontrollably. I would hide my tears in the shower because I didn't want my mother and my husband to know what I was going through, because it was like, why are you sad? Like, you have a healthy baby, you have a healthy child, why are you sad? And I just had these uncontrollable feelings of sadness and despair. I just did not know what to do. And so eventually, after a few weeks of that, I told them, it's like, this is what's going on with me. And so they were supportive of me getting the help that I needed. And so I spoke to my OB and she referred me to a therapist, and I was in therapy for a few months.
Wow.
Which really, really helped a lot,